All right, good afternoon, everybody. My name is Mamadou Samba. I'm the Chief Operating Officer at the Department of Licensing and Consumer Protection. Welcome to our third Flavor Tobacco Roundtable. And I have a wonderful guest here. I'm going to allow them each some time to introduce themselves, and then we'll jump into the questions. Mr. Bo Finley.
Hi, my name is Bo Finley, and I'm the Chief Enforcement Officer at the Department of Licensing and Consumer Protection. As such, I'm charged with enforcing the Flavor Tobacco Prohibition Amendment Act of 2021 that puts a prohibition on flavored tobacco throughout the district and implements a prohibition on the sale of electronic smoking devices within a quarter mile of any district, middle, or high schools. And that includes public schools, charter schools, and private schools. To date, we have visited all tobacco products licensees in the district, over 800 of them, and gone through again to the 492 companies that were not, or businesses that were not in compliance in the initial check, and issued 47 notices of infraction to these businesses for being in violation of the prohibition.
All right.
Good afternoon. I'm Carrie Dahlquist, Program Manager for Tobacco Control at DC Department of Health. I oversee programs that work to prevent initiation of tobacco use. We also support cessation programs for people who wish to quit smoking. We also work to reduce secondhand smoke and address the disparities in tobacco use.
All right. Josh.
Hello everyone, my name is Josh Brown. I serve as the policy chair for the DC Tobacco Free Coalition. The coalition brings together more than 70 organizations, big and small, in the District of Columbia, to make our communities healthier and take on big tobacco. We're really proud to have worked hard to get this legislation passed, and we're really proud that it is being enforced and these products are coming off the shelves. Thank you.
All right.
Hi, I'm Carol Magruder, and I'm one of the co-chairs of the African American Tobacco Control Leadership Council. And we have been working as the tip of the spear in the U.S. market to get mentholated tobacco products off of the U.S. market ever since the Tobacco Control Act was signed in 2009 and menthol was left on the market while the other flavors were taken off at that time in combustible products. And I'm very happy to be here with you all today.
All right.
And I'm Shelley Gressler. I'm the DC rep and head of government affairs for an organization called Parents Against Vaping E-Cigarettes. We are a volunteer grassroots organization that we are working to remove flavored tobacco products from the shelves.
All right. Well, thank you for the wonderful introduction. I'm going to throw the first questions at Bo. During your introduction, you talked about what flavored tobacco is. Tell us more about what's in the law,
Okay.
what is flavored tobacco, and for the average person, what is it and what does it do?
Well, so the Flavored Tobacco Prohibition Amendment Act of 2021 defines flavored tobacco as any tobacco product that imparts a characterizing flavor other than tobacco, or synthesized nicotine product. It doesn't just have to be a cigarette; it can be a vaping product. But the law also defines what a characterizing flavor is, and that's a taste or aroma that is distinguishable from tobacco. So that includes menthol cigarettes, it includes cognac-flavored cigarillos, it includes, for example, tobacco components such as flavored rolling papers, and of course it includes flavored electronic cigarettes.
It sounds like maybe Shelley, in your introduction, that this law might have originated from work that you might have done or your organization has done. Is there a connection between how this law was initiated between the type of work that your organization does?
Yes, we've worked in a coalition with a lot of public health groups and with the DC Department of Health. As Josh mentioned, the coalition is made up of how many groups?
A whole lot.
A whole lot. Everything ranging from, like we said, the DC Department of Health, Howard University, all around to Boys and Girls Clubs, and Heart Association, Lung Association, Tobacco Free Kids, and our organization. we're seeing a proliferation over the last 5-6 years of these products. And every time we make any inroads, the tobacco companies shapeshift. And they figure out how to get around, whether it's city law, federal law, and these kids are hooked. These products have been appealing to kids. They're in flavors, and the kids are going to migrate to whatever flavor remains on the market, whether it's menthol, whether it's cherry, whether it's mango, whether it's peppermint, whatever is on the market. So it's important to clear the market of all flavored tobacco products.
Is that the biggest challenge you face with tobacco companies shifting? What is the biggest challenge you face? Is it resources? Is it lack of, I don't know, resources, funding?
Well, right now, the biggest problem that we have, there are a lot of these products are coming in from China. 90%, it's estimated, 90% of all disposable vapes, which are very inexpensive to buy in this country, are coming in unregulated. They were able to get around US laws. In China, these things are illegal. They said that they took them off the market because they hurt kids, but it's okay for them to take them off their market, but to flood US market with these products. And the kids are able to get them. They get them through TikTok. They get them from local stores. Whether or not there's age regulation or not, there are ways that these kids figure out how to get around them. And social media promotes them. They glamorize them. They make them seem cool. And that's the biggest problem. That these kids were sold a bill of goods. Kids 5-6 years ago were told that these were just water vapor, that they're not harmful, they're not addictive, and that the FDA was going to approve them any day now, and none of that's true.
You mentioned social media, so I want to go to Josh, or either Josh, Carrie, or Carol, about why is this becoming more popular with kids? Social media has something to do with it, but tell us more about how is social media playing a role in making kids more addicted?
Sure.
Right? And what could be done to sort of counter that?
So I think it's important, and I think Carol should speak on it in a second, to talk about the arc of big tobacco from the 50s to today, how they've marketed specific populations in very targeted and aggressive ways to get them hooked on particular flavors. Since 2016, Juul was the first one with e-cigarettes to do this with young people, targeting them with these new novel e-cigarette products, mainly on social media. So the average adult wasn't seeing these advertisements, wasn't seeing these influencers that were being paid by big tobacco to push these products to make them seem safe and cool and sexy. But this is the same type of playbook big tobacco has done for generation after generation for specific communities. Carol, can you talk a little bit about how big tobacco has done this with the African American community?
Sure. So with the mentholated tobacco products, which are your Newports and your Cools, in the 60s and the 70s, the tobacco industry company cartels, I call them, because they are federally adjudicated racketeers like the mafia, came into the black community actually physically giving cigarettes out to children as young as 9 years old, like Marie Evans in Boston. They infiltrated our media. So as a child, when I came up, you know, having a black magazine was a big thing. So Ebony and Jet, when those magazines came out, we would wait for them to come out every week to read them. And they were supported by Newport Advertising in almost every single edition. Our newspapers, which are African American newspapers, started to free us from slavery. The first papers, that's what they were about, Freedom's Journal.
Right.
And our newspapers have a very different relationship with us than the average newspaper, than the New York Times has to its readers. You know, it's a family, and that they're trusted sources. And so when the tobacco companies would give money to or take advertising in black papers, it cut down on reporting against these products and brought silence and a complicity, and also our leaders as well. We need leaders and organizations. So that is the pernicious legacy that we're living with today, with the e-cigarettes, the mistake that they made, because when they were doing this, and in some of the litigation that's come out, there have been millions of papers, internal tobacco industry documents, where it said, don't do to white children what you're doing to black children. Don't go to the suburbs. This is for the urban, that's black environment. But with e-cigarettes, they started with the suburbs. They started with the advanced placement kids and the soccer kids, and that's how we got paid, was because these mothers came together. You know, when your kid is at the dinner table just annoying you, and what they're doing is they're being sold and they're being marketed to right under our noses. And we look up and we have this epidemic that's going on where our, you know, and I believe in telling the truth. When I was a teenager, I would have given it a shot. I would have tried it. It's sexy. It smells good. It's just too much fun against the adults that you could sit up and do something right in front of adults and they wouldn't know. You wouldn't have the same smell issues that you have with combustible cigarettes, which I could have never gotten away with my parents coming home smelling like a cigarette. But with the vaping, you know, so that we want to punish our kids now when we're the adults and we let this happen, and we need to correct this big error that we have made.
So Carrie, so kids seem to be under the impression that this is not as harmful. Can you speak to what are the harms? What are the harms? What should parents know, and what can parents do to support help?
Certainly, and such a key issue, a key part of this issue is the fact that these products are not safer than cigarettes. They contain many of the very same chemicals that you find in tobacco smoke. And they do contain nicotine, oftentimes much higher amounts of nicotine in e-cigarette cartridges than you would find in a pack of cigarettes. An e-cigarette cartridge might have as much nicotine as one full pack of cigarettes, and kids could be going through several cartridges in a day. And that is what is addicting them to these products. So anytime you are breathing something into your lungs that is not just air, it has the potential to cause damage and cause illness. We did see that in 2019. I feel like the work that PAVE has done and African American Tobacco Control Leadership Council, all of our partners, Campaign for Tobacco Free Kids, Truth Initiative, they knew what was coming and they were beginning to raise some alarms. And then in 2019, when what we call a volley was diagnosed, it was lung damage that was happening because of kids using these vape products. There are a couple of different things as part of the product that was causing this, but it's still happening. There are still diagnoses of this lung injury. So there are other things as well, not just the physical effects and the illness that can be caused, but it's the behavioral changes. It is the mental health impact. A lot of kids are stressed. They're worried about school, worried about keeping up. Maybe they're bullied at school, and so they look for something. They look for a sense of something that they have control, and I can ease my stress. And a lot of kids think, oh, this is a way for me to reduce stress. It actually makes it worse. And kids don't really understand that or realize that when they are being marketed a product that, oh, this is safe. This is safer than cigarettes. This isn't the same, but it really is.
Can you speak to how the product is marketed, which is, so Josh touched on that a little bit.
Yes.
How is this done specifically targeting, teens, children? I know, you use social media, there's
Right.
algorithms to kind
Yes.
of lead you to speak more about how is this purposefully targeting a community and
So with social media, there are people called influencers. And
like poison influence.
yeah, like we have a panel of influencers here today. I'm fortunate to be here with them. But there are influencers that have these huge audiences of thousands of kids, hundreds of thousands of kids, youth and young adults across the country, who are following them and want to be like them and look like them and act like them. Well, so many of these influencers are targeted by tobacco companies, by these vape e-cigarette companies to market their products in a way that doesn't look like marketing. And so it doesn't have the same kind of disclaimer. When you buy a pack of cigarettes, or when you see an ad in a magazine for cigarettes, it says Surgeon General's warning. That's not what's happening in these environments. Oh, this is great, this is fun. Look at these cool tricks I can do with, with vaping. And so it's appealing to them. It's showing them, as Carol mentioned, this is really cool, this is fun. So that's really the crux of what is happening. It's looking at the environment that is out there, looking at how they can influence kids through these influencers, and really just taking advantage of
I
that.
remember when I was younger, looking at the Marlboro Man.
Oh, yes.
Growing up in West Africa, and I want to be like the Marlboro Man, which is another conversation for another day.
But that's exactly the thing. It
Right.
is a page out of Big Tobacco's book.
Right.
And we know what they do, we see what they do.
Right.
They've done it before, we know they will keep doing it again, they will be shape-shifting. But you asked earlier, like, what are we under-resourced, what are our challenges? Tobacco control is, in a way, tiny but mighty. We're the Mighty Mouse going after the big bad wolf. And, for everything they throw at us, we are able to come back and say, hey, this is wrong, we're going to fix that. We've made lots of progress, but there's still so much to do because these companies continue those practices over and over.
And Mamadou, can I just
Please,
add?
please go ahead.
It's also the specific flavors that they're using. Like cotton candy, pina colada, strawberry, peach, mango. These are flavors that are really attractive to kids. And menthol makes smoking easier to start and much harder to quit. So it's not just within the African American community, they did the same tactics with the LGBTQ plus community. And for the bulk of young people who start any sort of combustible cigarette, it's with a mentholated tobacco product. So Big Tobacco knows that flavors makes this poison go down so much easier. And that's why Bo and his team are going after the retailers that are selling the flavored tobacco products. These are the ones that are hooking our kids.
I would like to also mention, it's not just the flavors, it's the packaging.
Yes.
It looks like candy. It
Yes.
is on the checkout, sitting right next to the candy.
Right.
So there's just lots of kind of insidious ways.
And not only that, is a lot of the products also have been made to be deceptive.
Yes.
They look like pens, they look like highlighters, they look like normal objects, flash drives that unknowing adults don't realize. We would go into schools and we would pass around products, and every time they would go around, you would hear a gasp from parents. I mean, this was consistent. It didn't matter if it was in Washington, D.C., it didn't matter if it was in California and Florida and Michigan. You would hear the same reaction like, oh my God, I see that on my kid's desk. Or I've seen that in their backpack. Because the products were made to look
Like
deceptive.
right.
And on something else like that. And in terms of the mentholated products, we are also seeing a rise in what is called iced flavors. So it may be vanilla ice or it may be cherry ice. And what it is mentholated on top of. So it has that cool feeling going down their throats. So you would ask kids, are you using a mentholated flavor? And they were like, no, I'm using cherry ice.
Right.
Not realizing that that's exactly one more level to make it a little less harsh on their throats
Right.
and to have them take more. And then bottom line is to be more addicted and harder to quit.
Sure.
It's the spoonful of sugar to make the
Right.
medicine go down.
And then the conversation now, as, you know, trying to normalize vaping, is that vaping is harm reduction, that it's gonna help smokers to stop, and so we can't throw the baby out with the bathwater because you know, it can help smokers to stop smoking. And I was
Right.
in London when they announced,
Right.
because England, the UK, they're actually sending vapes out to smokers in order to help them to swap out. So harm reduction is not about, we grew up in San Francisco at the beginning of AIDS when needle exchange was a novel revolutionary idea, which consisted of giving people who were IV substance abusers a clean needle so that people wouldn't share needles and give each other HIV/AIDS. So in San Francisco, we didn't go out and give everybody a needle and say, in case if you want to be an IV drug user, here's a clean needle.
Right.
No, it was for people who had that problem. So if we are talking about vaping to help smokers really stop smoking, then that should be a medical intervention. It shouldn't be all of these millions of products that are coming in, these cheap products coming in through China that are a burden on our
Right.
ecology, our environment. It should be a medical intervention. We should take out a raspberry poop and unicorn poop and these flavors, sex on the beach, and it should be that way, so that it takes the profit out of it and it
Right.
takes the sexiness out of it.
Right.
Because we can't compete, we have Chantix
Right.
with the cold turkey for cessation, and then it's all this array of all the sex, drugs, rock and roll
Right.
that are what sells this stuff to our
Right.
children and adults as well.
And there's no evidence that vaping will keep you from using these products. The little bit of evidence that is available that shows some, harm reduction is that it gets you off of smoking combustible products, but then you're still using this vape product that still has those same chemicals and still has the nicotine in it. So really, in order for us to say this is a harm reduction product, like Carol said, it needs to be a medical intervention. There needs to be research behind it, showing that yes, there is proof that this works. Instead, there are several evidence-based cessation treatments that we should be promoting.
And that would include like reduction in nicotine levels.
Yes.
All these vapes have the same nicotine level. If it was really used as a cessation, you would have step down, like Nicorette gum has a step
And
down.
much higher
Exactly.
nicotine levels than what's available in the UK or in Europe.
Right, and so we have higher levels of nicotine
In other countries.
than other countries.
I wanted to speak a little bit more about regulation, but you touched on some of the resources, and I was just wondering, and we can talk about it as we go, but recent lawsuits, and fines, settlements by Jules, how can those funds be used to sort of provide more support,
Right.
wraparound services, health, education awareness for kids' parents to make sure that kids are more aware, so that when Bo and his team go out to do enforcement, those devices that are deceptive don't really fall
Don't have
under the
the
radar.
effect,
And then Bo, I
exactly.
want to talk to you about the type of enforcement that you've done in the district.
So it is very critical that any Juul settlement dollars be committed to evidence-based and evidence-informed tobacco control initiatives. This is mass media campaigns, those counter-marketing campaigns from what Big Tobacco is putting out there. It is proven cessation interventions and emerging cessation interventions. Those things that we're beginning to see from one community to another, their needs might change. What does that community need? Let's focus on that. Education, of course, but also to kind of tie it back, it is enforcing the laws in place, and not just the flavors law, but also Tobacco 21. DC in 2018 began enforcement of its Tobacco 21 law. A couple years ago, nationally it became illegal. It became, you could not sell tobacco products to anyone under 21. That's a really critical piece of this as well, to just keep it out of the hands of our youth and young adults from the very beginning. So those are where the public, the people who are concerned about this, really need to make sure that those funds are dedicated to those proven initiatives.
So, but I want you to tell us about what your office does. How do you enforce the law? And when you go out to these businesses and you see a business carrying flavored tobacco, what do? You take it away? Do you take it home?
No, we don't.
But what do you do?
I don't have a closet full of menthols. So the
Yeah.
first thing we did, if we did
And
have,
feel
yeah.
free to jump in.
So the first thing we did was we went around to all the businesses and let them know about the law. We mailed them a letter detailing the requirements of the law. We emailed them to the businesses whose email we have on file, and of course we went to the individual businesses. After we did that, we issued an administrative issuance detailing the fine structure should somebody be in violation. The first violation is a $2,500 fine. The second violation is a $7,500 fine. And at that point, we can move to suspend businesses' tobacco license. And then the third violation is $10,000, at which point we are required by law to move to have that license suspended. Now we haven't revoked, sorry. We haven't gotten there yet because we've only done one full round of enforcement. But we've got a limited staff, but we're going out every day, and we're hoping we can. Each round will be fewer and fewer businesses that we're visiting because everybody else will be in compliance. But we can only do so much on our end. We also need the help of the public. Organizations like PAVE, we need parents to, when they walk into a business and they see flavored tobacco products on the shelves, they need to file a complaint with us so that we can go out there, write a notice of infraction, and really start getting those products off the shelves. So we don't always know when somebody is doing this. For example,
How's the complaint process works?
well, I'll get there in a second. So we don't know if, for example, a corner store that does not have a tobacco products license, they might be selling tobacco products. We don't know that unless we go in there. And there are a lot of businesses in the district, and we only have about 21 investigators. We cannot hit every business. So that's where we rely on the general public to say, hey, look, this store is selling tobacco, and if they don't have a license to do so, we issue a notice of infraction for that. If they are selling a flavored product, we issue a notice of infraction for that. But the complaint process, so we have a form on our website, dlcp.dc.gov. We also have a flavored tobacco sort of FAQ that we've developed in partnership with several people on this panel, so thank you, which has both a list of, a non-exhaustive list of prohibited products, for example, Newports, as you mentioned, and other products. I think Elf Bar is one of them. But it's a non-exhaustive list, but it is a place where parents can take a look, or teachers, and say, hey, is this product that I find my child with, is this something that's forbidden? And if so, we have a link to our complaint form, and that whole website devoted to flavored tobacco is, or the prohibition of, is dlcp.dc.gov/flavored tobacco. So it's kind of easy to remember. And we've got our complaint form, we've got a map that shows where in the district all middle schools and high schools are, so that there's sort of a heat map showing that if a tobacco products licensee is within a quarter mile of those schools, they're prohibited from selling electronic smoking devices, regardless of flavor. So we're hoping that will do, on the supply side, really curtail the provision of tobacco products to you.
Sure.
Can I
Yes,
just mention one
yes,
thing?
please.
There are a number of states across the country, jurisdictions that have passed these laws. Enforcement of these laws is not easy, and we've seen many places really struggle with it. Ideally, these products would immediately come off the market because retailers would say, these products are illegal, these products are harming communities, I should not be selling them. I should be selling something else instead. But unfortunately, there are a lot of retailers out there that want to continue to sell these products. And the fact that the team at DLCP is so diligently working to reach out to every single one of these retailers and then go back and visit the ones that they have found to continue to have these products and issue the notice of infractions and action.
Is DC in sort of a, so what trend are you seeing nationwide in terms of flavored tobacco enforcement? And are we consistent with that trend in terms of how we're enforcing?
Well, DC's in a unique position because they actually have a law on the books,
And other states don't?
and other states do not.
Like what?
California, Massachusetts, and the District of Columbia.
And then we have cities all over the country.
Okay. You guys need to move to DC so you can,
Yes.
or we need to go there.
I
Right.
think DC is doing pretty good from what I
Right,
see.
no, and there is, and we talk with our friends and neighbors in Maryland
Okay.
and in Virginia. you
And
know,
they don't have a flavored tobacco?
They do not, so, the hope is that they will see the success that DC has, and that they will move. Some states have stricter laws than others about what local municipalities and counties can pass in
But
terms of this.
is it risky for them, the district, because if they don't have a law in Virginia, I don't know about Maryland, can DC kids travel to Virginia
I
to
have,
purchase?
I have a little bit of response to that.
Okay,
There was a small study in Massachusetts that looked at tobacco sales after the passage of their flavors law.
okay,
Flavored tobacco products clearly off the shelf. They began to see overall tobacco purchases go down. So you did not see people shifting from those flavored products to the non-flavored tobacco products. They also did an analysis in New Hampshire, which neighbors Massachusetts, and they did not find a corresponding increase in the sale of flavored products in New Hampshire. So it does kind of lay rest to the idea that, oh, well, if we have this flavors ban, people are gonna go someplace else and buy these products. That's not necessarily the case.
And generally what happens is that one city does it and then the neighboring cities begin to do it.
Copy.
Rather than that one city does it and then everybody goes out and buys their products in the
Right.
neighboring
Right.
cities. It's really a quilt that we
Right.
build, and that's how commercial tobacco, because it's hard to get anything done on, once you go up
Right.
to the state level or the federal level, but in a
Right.
city where you might run into your city council person at Starbucks,
right,
they have to see you, they have to see the kids,
Yeah.
and so it's easier to get things done on that local level,
right.
and then you move to the next city. So in California now, we have, so many cities and counties now that have passed
Right.
flavor laws, and that, that's gonna spread out, and then that tips it finally to the state or to the federal government.
And that's how the smoking ban in the district worked.
Right.
I mean, we were early adopters, and I think Montgomery County followed suit, and other counties in Maryland and Virginia followed suit because of the work that
Right.
people in the district did
Right,
first.
especially in restaurants.
Exactly.
And then the conversation was, oh, the restaurants are gonna go out of business, people are gonna go,
Go to
and
Virginia.
then even
Right,
smokers
right,
like
right.
non-smoking restaurants,
Right,
even
right.
smokers like it. So the rhetoric, the scariness of when we make these laws, they do not pan out. And
Right.
that whatever people thought was gonna happen, the restaurants are still
Right.
open. No stores have closed in San Francisco because of including with the COVID,
Mhm.
because our law happened around that same time. Stores just aren't going out of business wholesale because they can't sell these products that kill people and
Right.
addict people.
Right.
And they have to find something else to sell that's a
Right.
little more wholesome.
Right, that they have now more shelf space
Okay.
to sell something else. And if if the sale of these products was the only thing keeping them open, then their business model is not very good.
So I have one last question before I do a last round. Maybe I can throw this to Josh about how stores are placing products within eye level. Is there something that could be done, legally to sort of say you can't place these products at the cashier? What could be done to sort of circumvent?
So that's a great point, particularly if you go through communities of color in DC and across the country, you see so much advertising for these unhealthy products. And it's not just tobacco products, it's very sugary products, it's alcoholic products. These companies know that they can get away with marketing directly to our most vulnerable members of our community, our young people, are most likely to be influenced by this marketing and get them hooked on these products. But the good news is, in state after state in city after city that have passed these laws. Once these products come off the shelves, the marketing leaves the retailers as well. And we're starting to see that bit by bit in DC. For the retailers that are no longer selling flavored tobacco products, e-cigarettes, mentholated tobacco products, the advertisements for those products are no longer in those retailers.
But how they get in the way, because we have now more minorities elected into office than probably ever.
Yep.
In a lot of states, these guys are in positions to make law, to make impact, to change things. But how are they still getting away with these tactics in minority communities when we have the people in place who can potentially make a change?
That's a great question. So, one, Big Tobacco has a lot more money than our
That's
small
true.
little community
Yes.
grassroots organizations. And unfortunately, they use that money to buy people off and to muddy the water. But the reality is, in the District of Columbia, we won because we had the facts, the science, and the community on our side. When we got this law passed, it was a diverse coalition of advisory neighborhood commissions that passed resolutions of support, the DC State Board of Education that passed a resolution of support, the Association of Civic and Neighborhood Associations, faith organizations, black churches, synagogues, mosques. You had so many small and big groups that came together and said, this is what we want as a community.
Right.
We're gonna take our health in our own hands. And the DC Council and Mayor Bowser stood up and said, we're gonna pass this law. And we are so grateful for the leadership of our elected officials here in DC. And state after state, we are seeing more elected officials stand up and say, I'm gonna make our communities healthier.
Right.
We know 45,000 black people in America die because of tobacco-related illnesses every single year. That is too many. Too many Americans, over 800 district residents die because of tobacco-related illnesses. That is too many. That's more than homicides, more than car crashes, more than AIDS. It's too many. But we can change that. These are all preventable deaths. And we're doing that here in the District of Columbia, and we're seeing that grassroots movement after grassroots movement across the country.
And not only that, is the healthcare costs that are associated with it, where you start to see rationing of care because there's just not enough money to go around.
Over $100 million is spent in DC annually on Medicaid expenditures related to tobacco-related illnesses. That's over $100 million out of DC taxpayer dollars
Right.
that we have to spend. That's a lot of money.
It is a lot, man. No, this is a great conversation, and I hate to end the day. I mean, we'll continue to have this conversation as we go. So I want to do one last round. Any last thoughts? And then we'll end with Bo here. Any last thoughts, takeaways?
I think it's just so important to know what's going on in your neighborhood. You know, to find out who has these products, where the kids are getting them, who's selling them, and to report it when it happens. Whether it's the local CBD store that is selling these products, commend the 7-Elevens. They were very quick in saying these products are not to be sold in the District of Columbia. And there are a lot of 7-Elevens in the city.
Yeah, a lot. Yeah.
And it is one of those things that we really, really need to report when we're seeing it and to follow up. Bo's team has been wonderful. When I put in reports, they follow back up with me.
Right.
And they
What's the
tell me what
turnaround
it
time,
is.
by the way?
For flavored tobacco investigations, we typically have a 30-day turnaround, but
Okay.
because flavored tobacco, we're doing so much proactive enforcement, we're able to couple, when, for example, when you file a complaint, we're able to couple the going out with checking on other stores in the neighborhood.
Right, and so I think that that's so important, and anybody can do it. You don't have to be an undercover agent. You walk in, all you have to do is say, do you have flavored vapes?
Right.
I'm looking for disposable flavored vapes. And a store will either have them or they will not.
So I want to do the last one, but I just thought about something, a question for Bo. Is there ever a thought of training residents on how to detect, enforce,
Well,
go to these communities and
I'm glad you asked, because
it's it's a great idea.
This
You can give me
dovetails-
credit for that.
Oh, this-
That's productive, I knew.
This dovetails with your earlier question
Yeah.
about, about the settlement or the award for
Right,
the
right.
Juul settlement and, the multi-pronged approach to
Right,
reducing tobacco consumption. It's enforcement, it's reducing the supply side that's what we're doing.
Right.
There's also cessation and, we didn't really get into cessation today as much as we have in other panels. But, as I mentioned, we do require parents, teachers, fellow students to say, hey, look, there's a store selling this stuff. But the education component is both on what is, how to complain to us, but also what products are complaint worthy
Right.
and should be targeted. And so, yes, I think that the education component is very important. I'm not sure we're institutionally the agency that is best set to do education and teaching parents what to look for. But we are happy to, once pointed in the direction of somebody selling something they shouldn't, really happy to go out there. But I know that Carrie and her team might.
I was gonna say, I love the way you looked at me. Yeah,
Yeah.
yeah.
No, that's a great idea. I mean, it just came to mind, but I'll
So in California, because of our taxes, tobacco taxes, we have a whole city, mechanisms in each city, and it just depends on who's doing the enforcement.
Right.
But we have youth, they're trained, they're paid to go out as decoys to buy cigarettes. And
Okay.
that happens all over the state.
We do that too.
And, okay.
And we are partnering with the Department of Behavioral Health, or we are looking to partner with them on using what are called, I think, SINAR funds.
Yes.
And-
SINAR
yes,
compliance.
Yes, SINAR compliance, where there will be an investigator from our team and an account manager from their team, along with a decoy purchaser, somebody who's actually, I believe, 16 or 17 years old, and they'll be under strict supervision the entire time. Will attempt to make a purchase, and then if the
Okay.
purchase is successful without an identification, or even with an identification, if the purchase is successful, we'll issue the notice of infraction.
Nice. Okay.
And big picture, that you can, if you expand that can help with police relationships in the community. You have the school resource
Right.
officer working
Right.
with young people that helps them to have ownership of their community.
Right.
So not looking at it as a one-off, but as a program and building something around it. As a teen, I did a drive-along with San Francisco police officers, and while it didn't change all the relationship I had with them, I have never forgotten it, of being in a
Right.
police car with an officer who liked me, and, and what
Stands
a
out.
night that was. So,
Right.
of using these opportunities to improve the relationships that we have with the people who enforce the laws, to help the children to see ownership of the laws, and that this is their part of the community, and they have a right to have a decent, healthy community like everyone else does.
Great. Josh, last one.
Yeah, I just want to say, on behalf of the coalition, thank you so much, DLCP, for the work that you're doing. And I also want to thank DC Health. You guys have been instrumental in tobacco control and making our communities healthier and being a core part of our coalition. And we're really blessed to have both Carol and Shelley here, African American Tobacco Control Leadership Council and Parents Against Vaping E-Cigarettes, have been leading this fight for a very long time, particularly AATCLC. Has really been leading this fight for a very long time. We wouldn't be able to do this in DC without these national organizations providing the support, providing the guidance. So thank you guys very much. The residents of the District of Columbia really appreciate it.
Thank you.
And we know he's a new dad.
Yes.
And
Yes.
so my daughter is
Congratulations.
34, but I have never lost the feeling of protection of her
Yes.
when she was a baby.
Yes.
And that's how I feel about the children
Yes.
of everywhere, all over the world. I feel we want to protect them. We want to help them to grow up without having to jump over
Right.
hurdles
Right.
to get to adulthood, and to be successful and happy in their lives, wherever that takes them, without having to get through all of these hurdles
Definitely.
that are put in their place. So our job is to take those hurdles.
It's hard enough growing up.
Yes.
Of course, of course, of course. Yeah.
I'm gonna put in a plug for cessation.
Okay, let's
Since we
do it.
didn't talk about it a lot
Let's do it.
tonight. DC Health does fund cessation services for residents of the
Cessation?
district. Cessation.
What is it?
Support to
person
help
who-
you quit smoking.
Okay.
Yeah, I'm gonna stop, I wanna quit. Studies have shown, our population health surveys in the district have shown that at least 2/3 of smokers have tried at least once in the past 12 months to try to quit
To stop,
smoking.
okay.
And most smokers want to quit. It's really hard to quit. These are very, very addictive products. And you might try several times to quit before you have success. But keep trying, keep going for it. There are organizations and services to help. Ours is DC Quit Now. Residents can register for the program online at dcquitnow.org or call 1-800-QUIT-NOW. I can never remember what the numbers are. And they can have access to no cost one-on-one or group counseling, text messaging support, a web-based dashboard with information. They can also access up to 12 weeks of nicotine replacement therapy. So this is a great service that really is underutilized, and we are looking at ways that we can enhance what we are doing with our DC Quit Now program and expand our cessation services in the district. I'm also going to say we have a program called it's in conjunction with Truth Initiative. They are our partner for a youth engagement program. They have a program called This Is Quitting, and I totally do not know what the text number is.
Google it, it'll come right up.
This is where I'm going to ask that y'all flash the number on the
On
screen.
the bottom right.
And
Just do this, read this number.
yeah, read this
Yes.
number, read this text number and this message. And so there is vaping support for youth and young adults. Another initiative that Truth Initiative is doing an initiative on engaging students, high school, middle school, and college age students to get them involved in the process, to teach them how to be advocates and to advocate for themselves, for their community, for their friends. And so any kids that want to get involved in that, the number's right down there below.
Definitely. Thank you very much.
So one thing I did want to mention though is we spent a little bit of the early part of our discussion bemoaning social influencers or media
Yes.
influencers. But Josh and Carrie, you both have mentioned in past panels the use of social media to help people quit.
Yes.
So could you talk about that before I jump in with my final?
You know, I was doing some research for a presentation and trying to find the most up-to-date social media influencers who are pushing these vape products. And every time I would search for vape influencers, it would pull up a lot of anti-tobacco, anti-vape influencers. So they are out there. A lot of them are working with Truth Initiative. They're working with Campaign for Tobacco-Free Kids and these national organizations. So there are some good voices out there.
And I'll mention one more, that it's an awesome program the ATCLC is doing, has done a nationwide, it's somewhat international now, poetry contest, where they've gotten young people to do spoken words, to record it. So check out the ATCLC's social media handles, Saving Black Lives. Go to their website, savingblacklives.org. You can check out all of these amazing videos. So we have great influencers on our side
Nice.
that are not paid off by big tobacco, that are working to make their communities healthier, to get people, particularly young people, to stop using these flavored tobacco products.
And I do have the number.
Which is, you can read it off.
If youth and young adults are interested in quitting vaping, you can text Vape Free DC to 88709.
88709.
Correct.
Okay. I think it's noted.
Thank you.
88709. I remember that.
88709.
Just want to
Vape
copy the
Free.
password.
There
Oh, good to know.
you go. Yes, now we know.
Yes.
Well, so
That's what-
thank you all for being on this panel. I want to reiterate that the best way to help us can do our enforcement is to file complaints with us. We're out there every day doing what we can, but we don't have eyes everywhere. We need help with that. And again, our website is dlcp.dc.gov/flavored tobacco, and you can read you can look at our map You can see our FAQ, and if you've got proposals to make our FAQ more robust, please let us know. I know Carrie has some ideas too, so, you know, as we can see, it takes a lot of work from everybody in the community, from government to grassroots to national coalitions. So to the extent you can help us get the word out, please do so, and please visit our website and file complaints when you see people not in compliance.
Right, it really does take a lot of, so I want to thank everybody in this panel for joining us. Great ideas.
Thank you.
I want to thank everybody for joining us in this roadshow that we're gonna take nationwide. But anyway, thank you so much, and you know, thank you guys, and looking forward to seeing you guys at the next panel next week.
Thank
John.
you.
Thank you.
Thank you.